the public health and health system and black economic empowerment policies will also come into sharp focus during the ANC's 55th ANC National Conference. This afternoon, we examine the governing party's SOE policies and the implementation of the National Health Insurance, among others. Our SABC Specialist researcher, Velemseni Mthiyane, joins us again here today in studio. Very good afternoon to you once again, Veli. All right, so yesterday we went through 5 key policies. We go through a number of them today, 3 in particular, that is NHI, SOEs, as well as triple BEE policies. I want to start by talking about that of NHI. It doesn't seem as though we're getting through when we're talking about the issue of NHI. I remember in the past, Dr. Aaron Mzoledi, when he was health minister, this was very much high on the agenda, and I wonder if it still really features very high up on the agenda. Where are we in terms of the NHI?
Sure. Good afternoon, Fleur, and good afternoon to the viewers. Actually, if we look into the National Health Insurance, there is some progress that is being made in some districts. There are pilot projects that are there. So it's a matter of monitoring and evaluation so that they're going to come up with evidence-based. If we talk about the NHI, so that we're going to come up with evidence-based policy in terms of how to move from the situation that we're at. Let me paint a little picture of our health system. We look into 10 government departments, 9 provinces plus 1 national, who are having a budget of about 230 billion. And if you look in terms of that spending, in terms of GDP, it's about 4% of GDP. But now, if you look into the population as a whole, only 16% of the population are having access to private health care, meaning there are more resources with the private health care, but servicing the few. But if you look into those who are having access to the public health care, there is like a huge number of people being serviced by the limited resources. So the NHI aimed in terms of bringing equality in terms of the access of quality health care financially, so that if you are to access health care, it's not dependent on your socio-economic status. However, the implementation is key here. If you look into how our public health care department have been run, they leave to a certain extent much to be desired. The reason being is that there are these loopholes, lack of coordination between the provinces and national, and also to a certain extent, lack of proper governance.
And this speaks to the issue of inequality. I mean, if you have, let me get my maths right here, 84% of the population relying on public health care, but private health care is more resourced, surely that then, I mean, we're asking to essentially have problems, even if those hospitals, those government hospitals were, you know, fully equipped. If you're having a number of 84%, you know, how exactly, you know, is that, how are people working under those conditions when having to provide for 84% of the population?
Here's an issue. All the professionals, they follow the money. They follow the financial benefits. So you find most of them being in the private health care as opposed to public health care. So you have a huge number of the population being serviced by few professional health cares. So what this NHI aims to achieve, at least at an economic sense, access to good quality health care should not be determined by your socio-economic status. But the issue here that is not being emphasized, which I hope at the conference they will be able to reach, is the issue of the public-private partnership. There are concerns that with the NHI, it means there will be a disappearance of the private healthcare providers. But that's not necessarily the case. The issue is the trust. That can there be a trust between government and private healthcare so that they can work together to make sure that there is an equitable access to healthcare for everyone, regardless of the amount that they have or that they may pay when they access the private healthcare. So the issue is about equality, but also there is back in 2001, it was advocated that at least governments in Africa should be spending about maybe 15% of their budgets towards public health. Now, this was because of the issues that we know, like tuberculosis HIV and AIDS, and the significant need for primary health care, particularly in rural areas. So that's where we need to be in terms of the NHI.
Yeah. Just lastly on this particular point, one of the arguments that I'd heard, you're talking about public-private partnership. There were arguments when it came to NHI that, people were saying, I'm not going to pay exorbitant fees for healthcare, those of us who are able to be on medical aid, and then get the same benefits as, people that, are relying on public healthcare. Those were some of the arguments that had been put forward. I think partly that was also, as you say, painting a picture about inequality and people not wanting to share the resources. I wonder where we are at this point, and if this is still a debate that is having to be had when we're dealing with NHI.
Sure, that debate will not go away. But I think what government needs to do is the proper communication, and also to the way the NHI project needs to be governed, has to bring trust to everyone, those who are in the private healthcare, who are having medical aid. By the way, even that 16% or 15% that is having access to medical aids, only about 3% of that is comprehensive health care. So majority of them, they run out of funds before the year finishes, so and then go to the public health facilities to access health care. Yeah. So that's where the government is saying that even if you look into those who are having medical aid, they are not necessarily having full comprehensive covers. So to a certain extent, they run out of funds and they go to government. If you look into the treatment of ailments like cancer, it's very expensive. So by and large, you find that people who are having medical aid, they exhaust their funds, and then they are moved into government facilities like Charlotte Maxeke and other hospitals that offer cancer treatments. I'm just making an example. So you have the situation whereby those who are complaining, not necessarily complaining, but who are having concerns, are not having a fuller picture. But at the policy discussions, I would like if the focus to be on how to ensure that we benchmark the implementation of the NHI to other areas internationally, how they have implemented this, so that we can learn the mistakes, and so that also we could take some positives going forward.
And I think we saw an example, as you say, there was Obamacare, which was sometimes, sort of compared to NHI. But, we're running out of time. Let's talk about other issues. The ANC SOE policies, which has been a very big point, particularly in the tenure of President Cyril Ramaphosa, where there's been a lot of talk about SOEs and there's been a lot of talk about privatization. Where are we at this point?
The issue, as well as the ANC is discussing these policies and adopting them at this conference, is the factional issues and ideologies. There are those who believe that for the state, for growth to happen, it must be led by the state. But others are believing that you must open enough room and deregulate so that the private investors would come and invest and lead growth. So when it comes to SOEs, we have seen with the ESCOM, we have seen with the SAA, we have seen with Denel that the issue of governance is a key issue that at the discussions in terms of policies, they should be able to come up with a plan of saying, yes, if we say we want a state-led development, but how are we going to address the issue of governance and the issue of meritocracy? To a certain extent, how governance falls, it's because the people that are, or the cadres that are deployed are not necessarily on merit. So you find a situation whereby people are put there for the sake of just signing and giving tenders and contracts to other people. So then you find that there is no aim or end goal. There has to be, to a certain extent, we need to reach a point whereby the SOEs, they generate some revenue for the state as opposed to taking away from the state. What is actually happening is that the taxpayers are paying huge amounts of money to sustain these SOEs. Maybe at the policy, at the one of the discussions of the conference, should they really be holding on to the state-owned entities, or they should be saying, we're letting go of a certain stake of some of those SOEs, or we'll let them to go away altogether because they are not benefiting the members of the public.
Yeah. Let's talk about black economic empowerment. And I mean, one can argue for and against. I mean, the point of BE or triple BEE was, of course, to level out the playing field. But as we can see, those playing fields have not been leveled. But the issue of scrapping it completely certainly can't be, given the fact that there are inequalities and that need to be addressed. But is this the way to then address those inequalities?
I'll take you back into the Black Industrialist Conference that took place in Sandton in July.
Yeah.
What President Cyril Ramaphosa pointed out, two things. One is that it's generational wealth and generational poverty. So the aim of the empowerment policies, particularly for the previously disadvantaged people, which are black people, is to make sure that there is a generation that can leave wealth for the next generation.
Right.
And then the other aspect of it is that if you compare the South Africa's economy with the global economy, is that 17% of employment in South Africa comes from businesses that are family owned, as opposed to our peer economies whereby 40% of employment comes from businesses that are family owned. So there is a need, particularly for the black community, to be empowered. However, again, the issue of how this has been used as a patronage network in terms of we give you so and so a particular stake so that you give, it's not open to everybody.
Right.
It's limited to those who are politically connected. Maybe the question is, should there be a review of how this policy is implemented so that as a ruling party, they are able to bring about those changes for the whole public to benefit. But if it's limited to those who are politically connected, it's defeating the purpose. And another point when it comes to BEE is that there are still structural impediments, particularly for black people, women, youth, people living with disabilities.
Yeah.
And the policy adoptions that are going to take place there, they need to come up with evidence-based policies to say, how are we addressing these barriers? We've been speaking about them for a number of times, but there seems to be not an oomph to ensure that we cross over in terms of complaining, but we are implementing. There has to be a need to, actually, President said when he was asked is it still relevant at that Black Industrialist Conference?
Yeah.
He said it is still very much relevant because lots of black people are still trapped in poverty and are still struggling with businesses. So such policies are still relevant. The issue is implementation, and that has to be a focus of the policy as the conference takes place.
Velemseni, a pleasure once again. Thanks very much for that interesting indeed. SABC Specialist reporter Velemseni Mthiyane joining us here, of course, taking a look at some key policies that the ANC will be looking into.